This video demonstrates endovascular coil embolization of inferior epigastric pseudoaneurysm in a 33-year-old female who presented with recurrent left-sided abdominal pain. CT abdomen and pelvis demonstrated a 1.5 cm left inferior epigastric artery pseudoaneurysm. This was secondary to iatrogenic injury to the inferior epigastric artery on the left during a laparoscopic procedure for ovarian torsion. We decided to treat this endovascularly and took the patient to the operating room and performed coil embolization of the left inferior gastric artery above and below the pseudoaneurysm, as well as embolization of the pseudoaneurysm cavity itself. Demonstrated here is the CT abdomen and pelvis that shows a 1.5 cm inferior epigastric pseudoaneurysm. Shown here is the demonstration of this pseudoaneurysm in coronal view. First, the femoral head was marked with a hemostat, and ultrasound guidance was used to access the right common femoral artery with a mini stick needle followed by the wire and micropuncture sheath. We then gained contralateral access by using up and over technique. The wire was advanced in the superficial femoral artery, and then we exchanged for a stiff wire. The patient was heparinized at this point in time. A long 6 French sheath was then brought in place and placed in the external iliac artery. We knew from our preoperative CT scan that we need to perform our angiogram at an angle of left anterior oblique of 38 and cranial of 18. Allowing us to better delineate anatomy and perform our endovascular repairs successfully. Once this was done, a glide catheter was introduced into the inferior epigastric artery, and an angiogram was then performed to better determine the size of the pseudoaneurysm cavity and the proximal inflow and distal outflow size of the inferior epigastric artery. Next, we decided to perform coil embolization of the outflow of this pseudoaneurysm cavity. We exchanged our glide catheter for an 018 catheter over an 018 wire. The 018 wire was then introduced in the outflow vessel of the inferior epigastric artery, followed by advancement of the catheter in this location. An angiogram was then performed through this 018 catheter, followed by introduction of coils in the outflow vessel as demonstrated in this video. For this outflow from the pseudoaneurysm cavity, we used multiple 5 mm by 5 cm pushable coils through this 018 catheter. This is followed by a repeat angiogram that demonstrated successful cessation of flow in the outflow vessel from this pseudoaneurysm. Next, a 7 mm by 7 cm pushable coil was then introduced in the pseudoaneurysm cavity, followed by placement of a 5 mm by 5 cm pushable coils in the inflow vessel to the pseudoaneurysm cavity. The pseudoaneurysm cavity and the inflow were coil embolized as shown in this figure. Repeat angiogram demonstrated no flow into the inferior epigastric artery pseudoaneurysm. This concludes our demonstration of successful coil embolization of inferior epigastric artery pseudoaneurysm.